Hello, everyone. This is Friday, May 1st. This is our briefing today. We've been a little late getting going and everything. We're getting some slides, additional slides that should give you some more valuable information put together. And I guess let's start off with what I think is respectful news, but at the same time, it's dag, I hate this. I mean, I can't tell you how much I hate this, but we've lost 5 more West Virginians. Our death toll now is at 46. We lost a 74-year-old male in Berkeley County, a 71-year-old female in Kanawha County, an 81-year-old male in Kanawha County, a 58-year-old male in Jackson County, and a 96-year-old female in Jackson County. You know, when you look back at it, and again, if all you're going to do is just think about stats, the numbers are good. But if you just think about just this, you know, we had 41 deaths and now we've got 46, and in one swoop, we've gone up in excess of 10% of our deaths, and I just hate it, and I really, really hate it. And I know our people are doing any and all that they can do, but I'm going to quadruple down and just urge our people in every way. I don't know what else our healthcare community can do. I mean, you know, for crying out loud, they're doing everything, but it's just plain terrible, and I hate it. So please, please, please keep them in your thoughts and prayers. And you know, it's just these are West Virginians. These are people, and these people have names. And like I said over and over, they've got loved ones, and so just surely think about them over the weekend and keep them in your thoughts and prayers. As far as our reopening, you know, we're reopening, you know, West Virginia strong to come back. Again, I caution everyone out there that we're dealing with a killer here. We're dealing with a disease that is absolutely a killer. And we see it because every day I've got to come out here and tell you of the West Virginians that we've lost. And it's tough, you know, from the standpoint of knowing that the killer is there. Knowing that you, West Virginians, have got to know that. And you have done incredible. You have done a miracle. But absolutely, you have got to be on guard, cautious, really, really, really smart. Now, in protecting, first and foremost, the elderly, but you've got to be smart, West Virginia, and I know you will be. You know, as we go forward, a week from this Sunday, we're going to have church services. And I want to talk just a second about that. I've had a lot of discussions with all different branches of the churches from every organization you can imagine. You know, Kenny Bass called last night, and you know, in concern. Lots and lots of people have concern. We want you to be able to go back to your churches, and we want you to be able to worship together in a family, in a church family, and we want you to be able to enjoy that experience that is absolutely the heart and soul of everything we are. All I would do is ask you just this. You know, if you're a person that's my age or older, think about maybe just giving it a little extra time before you're starting to congregate together. A lot of the elderly really enjoy church and enjoy that time more than maybe our young people do, and our young people should be there enjoying it just as much. But all I would ask you to do is just think about it. If you can some way, somehow, enjoy that service over the radio or whatever it may be the best to do that right now. From the standpoint of going to church, all the people that are at the churches, please follow our guidelines. Wear masks, alternate pews. Absolutely, we can have church and worship there, but we need to really be prudent and on our game, because the last thing we want is me reporting more and more of you as deaths. And it could be just that. So please take heed. A little extra time is good, but really and truly, we want you to be able. We want our churches to be open. We want our churches. We've never shut our churches down. We want that spiritual being that is the number one thing in all of us to be present in our lives as we go forward, trying to get back to something that resembles normal. But if you happen to be one of the older people, just think about what I'm saying. Think about maybe a couple more weeks would be better. But if you choose to go, please, all church officials and all church leaders in every way, and yourself, wear a mask. Absolutely follow the guidelines that we put out, and let's just hope and pray that we're going to continue to trend toward the way we're already trending. Now, I want to read this to you, and it's kind of the same thing that I've already read to you before, but on Monday, May the 4th, we're going to move to a safer, instead of a stay at home, we're going to move to a safer at home order that will go into effect at 12:01 a.m. Monday. The order strongly encourages all West Virginians to remain at home, but no longer orders you to stay at home. Again, I encourage all businesses that are allowed to open to do so only if they follow the guidelines and keep West Virginians safe. We continue to work with business groups to help them establish protocols. You should continue to stay at home if you have symptoms of COVID-19 or have come into contact with someone who has. I want to congratulate our state police troopers and the DHHR today. 20 state troopers and, working together with the DHR have orchestrated the delivery of life-sustaining medicines or medications to every hospital across our state in one day. And I don't have a list of what these medications are, but they're from the United States Strategic National Stockpile. And these medications that have shortages nationwide, but have been delivered quickly by our troopers to make sure they get to the people of West Virginia. And this shows the great cooperation between our agencies, and I thank them so much for that. Now, if I could just talk just a second about, as we move forward, about our hotspot counties. We have 11 counties that are our hotspot counties, and we've been in touch with all 11, and we're continuing to have feedback from our experts and from the counties and the people that are on the ground and the health departments and everything. We want a continued effort of a lot of feedback from these counties. Now, as we go forward, what we want to do is we're going to release over the weekend some additional guidelines in regard to the hotspot counties. Now, we know from the standpoint of the emergency orders and everything, the hotspot counties cannot have gatherings in excess of 5 people. We discourage gatherings in excess of 5 people. Now we've moved to 25 people, and where we're going on Monday, other than the hotspot counties and statewide. We're going to issue additional guidelines to the hotspot counties, and we're going to be soliciting more and more information over the weekend, and so that'll be coming out, over the weekend to those counties. We want everybody to come back online, and we want to do as much as we possibly can as we do the baby steps instead of the running. But we absolutely are very aware of the hotspot counties and their bordering outside the state neighbors and issues that we may have, and we're going to try to treat that appropriately. I want to talk just a second. We have our revenue numbers. They're terrible. We expected them to be terrible. And we've been watching this all along. Our revenue people, I meet with them all the time. I met with them yesterday. I'm going to meet with them again later today. Our revenue people are on top of all this. In the month of April, the state of West Virginia anticipated $3.69 billion. The year-to-date collections of more than $3.69 billion were $198.7 million below estimate, which puts us year-to-date $205.6 million underwater. Now, a goodly amount of those dollars are income tax monies that we anticipated on April the 15th that weren't here because we moved the date till July 15th, but there's still a tremendous amount of shortfall dollars because, the fact that West Virginia is just basically shut down and we're not doing anything. Now, that's one thing, absolutely to protect our people, and we knew this number was coming, and absolutely we've prepared for this number in every way. Now, how are we going to address the number? And I really believe wholeheartedly that we're going to address the number through the federal government allowing us to backfill revenue. We do not have that assurance yet, but we're working it. Today, I'm going to work, however long it takes, and I'm going to work through the weekend and everything to where I totally understand. I think I already do now, but I totally understand every single number, dollars coming in, dollars going out, where we expect to be, a pro forma of where we expect to be, everything it may be. Remember, I'm the business guy, and this is right in my wheelhouse and everything. Now, our revenue people really believe this would be the numbers, and they're honestly almost dead on track with what they believe. But at the same time, we've got to get our state through this situation, and it's a tough situation and everything. But I believe wholeheartedly that what's going to happen is that the federal government is going to allow us to backfill revenue, and then we're not a state that's upside down on pensions that you see on TV, where like Illinois is trying to get $40 billion to backfill all their pensions and do a kind of stuff. We're not that. We're a state that was tracking along and making money and doing great and having surpluses and everything else, and now this terrible pandemic's right in our lap. All we're asking to do is to be able to backfill the cause and effect of this pandemic. That's it. And I think our federal government is going to be all in and doing so, and they've been so with our small businesses, and they've been so with our individuals in regard to their additional pay that they've been sending people, and so I think they're going to come through on this too. Workforce has now processed 164,000 claims. 148,000 claims. There's been 164,000 claims that they've received. A great many of the 13,000 claims by the self-employed workers have been processed or are continuing to be processed. The last thing that I have on my list is I want to show you a couple trend lines. And Jordan, are you guys ready for these? If we could start with the, and I'll just touch on this just to say, well, we've already got one up here. This is our basically our percentage of positives on a daily basis that goes back to, I think it's March the 30th. Yes, it is. It's March the 30th. And you'll follow that trend line. Now, what we want to work off of is a cumulative number. Our cumulative number today has trended down a little bit more, and it's 2.43. You don't see, now that's our cumulative number right there. And you can see it's still trending the way we want it to trend. It's under 3%, it's 2.43. All's good in the neighborhood right there. But now if you could go back to the other slide just one second. This is our positive per test taken on a daily basis. And because there was some question about, well, what if you hopped way up in a day and everything? And I've said all along, if we hop way up, we're going to know what's caused us to hop way up. And then our strike forces and our medical team is going to go right there and try to do something about it immediately. But if you'll see, today we trended at 1.4%, which is beyond fabulous. So that's good. And all that's working the way we want it to work. Now, the last thing I'd show you is this R naught, chart, and that, the bottom line, and I'm going to get out of my field here, but Dr. Marsh is really, really good about talking about this, and I'm sure he'll come back to it. But the bottom line is this is an infection rate, where one infects one, and this is trending now at 0.76. So that means that one is not affecting one is now affecting 3/4 of a person. And so when you get that trend line below 1 on 1, you're doing good stuff. So all of this is good. May's here, and hopefully the rain's going to stop, at least, we want it to rain on our crop fields and rain on our gardens through the summer and everything, but we want the sun to shine and the temperatures to go up, and that supposedly is going to help us with this virus. But everything, as far as the numbers and everything, is trending in a way that tells us we can progress with going back and reopening West Virginia, the comeback. Now, except I tell you from the bottom of my heart, there's nothing good about sitting here and telling you we've lost 5 West Virginians. Nothing. Nothing about that is good in any way. All the numbers, all the charts, and everything else really and truly don't make a hill of beans when I'm sitting here and telling you we've lost 5 West Virginians. So, at the end of the day, I tell you over and over and over, we got to go back to work. If we don't, we know the suicide rate will go through the roof. We know the drug overdose rate will go through the roof. We know that absolutely we'll lose lots and lots and lots of people that way, if not others. We know if we were to slip into a depression in this country, that we would get into food crises, and then beyond that, who knows what could happen. Neighbor against neighbor. A lot of people that we have in our population have lived through the Depression, and they knew what it was like. Most of us don't have any idea what it was like. And so with all that being said, we know there's a downside to doing nothing, and we know there's a downside to doing something. We know we're going to have to live with this disease. I plead with you to take heed of all the guidelines, to look after the elderly, and to be safe. Be smart, West Virginia. We can do this, but we got to do it all pulling the rope together. Thank you so much.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Hello this afternoon, and I want to reinforce a couple of the things that the governor has said. So we are looking at several different types of data, some of which is cumulative, and that's the number that we're all watching, looking at reopening West Virginia. As the governor showed, we're also looking at the daily positive rate of change. We're looking at the county levels as well with the local health departments and the local health officers. And we're also looking at this other measure that the governor articulated, which is the R naught, or the R sort of sub-zero number. And that number is one that is an important one for us, because that does really give us insight that across the state, we've been able to really stop the spread currently of the coronavirus. And as the governor said, that means a single person infected with the coronavirus cannot infect even another total single person. And that's what you look for. The lower that is, under 1, the better. Ours has been fluctuating between about 0.74 and 0.78. And those are all very good numbers. And we'll be watching those numbers, all the governor showed, as we open the state and go back again. I'm going to, when all this started, I think that people probably were absolutely sick of me saying, important to remain distanced and wash your hands and don't touch your face or your mouth or your nose. I'm going to add one more to what I hope people do when we start to reopen. And this really goes with the safer at home policy, that for some people, they may think that we're saying, oh, we made it through, life is good, we're protected, no problems. But I think you heard today that, an additional number of people of West Virginians have died. And we know the virus is still there, and we have a low rate of infection, which is the number that we're so proud of, having that percent pauses under 3. But that also means, as we go back out, many West Virginians are not protected, don't have immunity, haven't been infected with the virus. And as we've said before, we have the most vulnerable population in the state. So as we start to reopen West Virginia, it is really important that each one of you also still continue to take the personal responsibility that you've done, which has allowed us to be in the position we're in. So that means if you don't have to be outside, then be at home. It means that if you can work from home, continue to do that. It means if you go outside and keep distance. Go outside, and if you touch something, use hand sanitizer, wash your hands, keep your hands away from your face. But one additional important ingredient with this reopening, that is, go outside and wear a face covering or wear a mask. We know that if, just like we did with the staying at home, if we get the cooperation and the commitment of all people in West Virginia, which we've had before, all of our community members, and wear masks, we not only protect ourselves from the coronavirus infection, we don't touch our mouth, our nose, and we are protected in many ways against the droplets which have the coronavirus. But importantly, if we are infected and don't know it, we are able to protect others, because it reduces that droplet spray and reduces the distance that can travel, which is dangerous for other people. And remember, about 70% of people who have coronavirus infection either haven't been diagnosed or don't know, pre-symptomatic. So importantly, as we go back out again and we go to do service, we go back to the stores or to the other activities that we like to do, remember, protecting yourself protects your neighbor, protects our healthcare workers and our hospital capacity, and also protects our state. So thank you.
Thank you, Dr. Marsh. Now we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Let me give you an update on the nursing home testing effort. I had talked the last couple of days about doing a summary, but we have the last facility being tested today. That will be completed, and those samples will be sent to the lab this afternoon. That means all 123 facilities have been tested. And we certainly want to thank the staff, the CEOs, the owners of these facilities for their cooperation in this effort. It has been really hard to believe that we've been able to do 123 facilities in 2 weeks and doubled our testing efforts in the state. Again, the first state in the country to do this. We thank the governor for his approach to this. We have, however, only about 80% of the results in. I thought it would be a little higher today, but we still have 2 or 3 days of tests to be returned to us. So we'll wait and do the summary next week when we have complete information. We expect to have all of those reports in by Monday. So we anticipate doing that summary on Monday. I want to mention one other thing. May is Mental Health Month. This pandemic is stressful and difficult for almost everyone. We all have a hard time dealing with not seeing our family and not seeing friends, and that is a difficult thing to deal with. 1 in 5 people experience mental health illness at some point in their life, and everyone's facing challenges during these trying times. We encourage you to take care of your mental health as you would and as you do your physical health. If you need mental health support, please consider calling or texting help for WV, and that number is 844-435-7498. That number should be up on the screen. There are many resources available under Coronavirus.wv.gov as well. So please be safe, keep your family safe. Thank you.
Thank you, Secretary. Now we'll go to Major General Hoyer with the West Virginia National Guard.
And Jordan, if you could, please put up the chart if you have it. Okay, I guess we don't have the chart. So on that chart, I wanted to highlight that to date, we have supported 683 stores with training and 80 medical and long-term care facilities with training, and highlight some of the things that and help reinforce some of the things that the governor and Dr. Marsh pointed out. In reducing the transmission rate, these guidelines and best practices are going to be essential to us continuing to be successful as a state. I want to highlight a couple of great examples that have gone on across our state over the past 49 days to date. One in particular is a partnership with the West Virginia Retailers Association, training those stores, training the workers on PPE, training on best practices for sanitization. You'll see in many of the stores that you go in, the workers are wearing face coverings. They do have shields or barriers between the attendants at the cashier lanes and the patrons. Many have implemented the spacing and the square footage requirements in their stores. All these things are important to us, continuing to stay disciplined on, as the governor and Dr. Marsh pointed out, so that we can continue to keep that transmission rate low. So I want to pay particular tribute to those essential workers in the retail industry who've been with us over the last 49 days to ensure that we had food, supplies, and the things we needed, but also have worked exceptionally hard on developing their best practices as we move forward to address the long-term requirements that we need to address this threat and keep that transmission rate low and keep our citizens safe. So again, I thank the retailers and essential workers, as well as our medical workers who have followed and stayed disciplined on these events. Thank you.
All right, thank you, General. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Annie Moore with WVVA.
Hey, Governor, is there any update on the plane transfer of out-of-state prisoners to West Virginia? And are any of those transfers scheduled for FCI McDowell?
Okay, Annie, I don't have any additional updates right yet. We're still working it, behind the scenes in every way as far as additional transfers and everything. And I think you said that with the possibility of McDowell, and I'm not aware of any that are going to McDowell.
All right, thank you, Annie. Next, we'll go to Anthony Izaguirre with the AP.
Governor, can you tell us what the state has bought with the Federal CARES Act money, or are you waiting to spend at least some of the $1.25 billion because you want to use the money to backfill the revenue?
Anthony, let me kind of walk you through that just a little bit. You know, I know we've gotten a letter, or there's a letter supposedly coming out from the Senate Dems. We've, you know, we're trying as best we can to take, you know, ideas and solicitations from everybody. We welcome, you know, talking to anyone across the aisle. You know, on both sides, it doesn't matter to me a bit in the world. You know, from the standpoint of additional information, but Anthony, just follow the math. You know, we're going to take all the data that we have or that we obtain, plus all the rules that we have to go by, and then we're going to make good decisions, and we're going to make really good decisions on that. But I ask you just to do this. I think the recommendation of the letter was that they had like $500 million of the $1.25 billion that has been sent to us, that's sent out to the small businesses. And we want to support our small businesses in every way, shape, form, or fashion, as I say. And so we're going to listen. We're going to listen. But now let's just think about this just a second. If 500 went to the small businesses and 500 went to the counties and the cities, you're going to have a bankrupt state. That's all there is to it. If you have the ability to be able to backfill the revenue, you know, and you don't backfill the revenue and you end up with a bankrupt state, then the small businesses are going to die and the cities and the counties are going to die. You know, we've got to be really smart in what we're doing, and we will be really smart. And we will take into advisement all the different, you know, approaches that come to us, and we welcome them. But at the end of the day, we're going to make the decision, and we're going to make smart decisions on what to do. And there's no question whatsoever that we're going to have a significant shortfall within this state. And by significant, I mean really significant, because our people now are thinking, you know, that if we really fall into the first quarter of next year in the situation that we're in, that basically $370 or $500 million shortfall could turn into a $700 million shortfall. That's why the government has sent us $1.25 billion. And that is just to ensure that the state, the heart keeps pumping and everything. Now, we're going to do everything we possibly can for everybody out there, but there's no point in everybody scrambling around right now trying to run for the cheese, because we don't even know the rules yet as to what we can truly do. I really believe our state's going to be fine. Our state is going to be fine because of the backfill on revenue from the federal government. But as far as all the other branches of everything, I believe we're going to be able to help our counties and our cities. We're trying to help our small businesses as much as we possibly can, you know, but really and truly, you know, we'll end up just doing the smart stuff.
All right, thank you, Anthony. Next, let's go to Steve Adams with Ogden Newspapers.
Yes, Steve Adams with Ogden Newspapers here, and I hate to beat a horse on this, and I know Phil has asked about this, and I think that was partially part of Anthony's question too. But with the shortfall, with right now, as much as you hope that we're going to get guidance from the U.S. Treasury to be able to use part of that $1.25 billion for budget backfill, right now that's just not what's in the cards, including it doesn't look like the next package that comes out will have that either, if Senate Majority Leader Mitch McConnell sticks by his guns on that. So would it not be prudent to get the legislature here maybe in June to try to move some rainy day money temporarily to just backfill that until we get that guidance that you believe is coming? Thank you.
Stephen, if we get to the point in time where we really are looking at a possibility of June, and we don't have relief that is in place to be able to handle this backfilling, you dadgum right we'll have them here in June. I mean, that's all there is to it. But I really think that you're going to have knowledge of what's going on within a matter of days. And by days, I mean a week to 10 days. You know, we've been in contact with our senators and our congresspeople. I'm in contact with the White House almost daily. I've surely got some inside baseball information, and I feel like, I don't know, but I feel like that we're going to be okay, you know, from the standpoint of being able to backfill and bridge us to where we get back on our feet. But I don't know that for sure yet. And if really and truly, way before June, if we get in a situation to where it looks like the information is not going to flow and us be able to do what I'm talking about doing, you dadgum right we'll have them back, and you dadgum right we'll have to figure out another solution. And if that be the case, we'll do that too.
All right, thanks, Steve. Next, we'll go to David Beard with the Dominion Post.
Hi, I'm getting questions, multiple questions from people on two issues, so I thought I'd put them both out there. One is I'm hearing from frustrated self-employed people who aren't able to get through the workforce to file for their federal PUA funds, and they want to know what to do. And the second is I'm hearing from people who want some guidance on planning graduation ceremonies, and they want to know who has to approve their plan. Is it the state board or the county health department or some combination of that?
Well, and it's David, is that correct? But David, you know, from the standpoint of what I know, every single call was answered yesterday. You know, and I try to follow up on that every day as best I possibly can. But you know, if in fact I'm in error about that, then I'm just in error about it. But to my knowledge, when you know, on what I'm reported is reported to me, that you know we have 100 agents that are working this, and every single call was answered. Now, you know, and as far as the graduation stuff, the county schools will set their graduation, and I hope they follow guidelines. And you know, well, they got to follow the guidelines, you know, to be able to keep social distancing and different things like that. But here's the thing, you know, and this is what I was hopeful of. I was really hopeful that what would happen is maybe people would just, you know, greatly postpone their graduations and look for a time maybe in the summer where they could bring those graduates back in. And maybe right now they, you know, a lot of people are having graduation, you know, in cars and going through that way and doing stuff like that. Well, that's great. But I hope they'll still look at the possibility of bringing the graduates back in the summer if in fact this thing does pass and we are able to do more and more and be able to celebrate that, you know, an accomplishment that the graduates and their families are really, really proud of.
All right, thank you, David. Next, we'll go to Paul Mullen with WCBC Radio.
Good afternoon, Governor. Thanks for the time. You're a coach. How much have you drawn on that ability in leading West Virginia through this crisis?
Well, let me tell you this. When it really boils right down to it, you can be a heck of a coach, but if you don't have players and you don't have a team, you can be a heck of a coach all day long and not have a very good winning record. I've got a heck of a team, and I've got real live experts around me, and you got to have a leader of the band, and the leader of the band's got to be the one that's calm under the fire. I hope people see me. You know, I can be fired up and everything else, but at the same time, you know, when the bullets really start flying is when I'm going to be at my calmest, and that's what I do with our basketball teams and everything else. And you know, I believe there's got to be somebody that is a calm head that really, really grasps what's going on during the course of the game and guides our team to where we need to go. And, you know, I really and truly have had the opportunity to work with a lot of people in the past, and this team right here is the real deal. And I am really, really, really proud of everybody, and just that the team is enormous. You know, if you think of all the county health people and all the different people that are all around us, and so at the end of the day, you know, West Virginians, you're a pleasure to coach, a real pleasure to coach, because you're the real deal, and I'm really proud to be your coach, that's for sure.
Thank you. Paul, we'll next go to Taylor Stuck with the Herald-Dispatch.
Hi, Governor. This is Taylor at the Herald-Dispatch. You've said, and other your experts have also said this week, you know, if you are immunocompromised or older and you don't feel comfortable going back to work, that you should stay home. But what if your employer, you know, doesn't work with you in that regard, and you also can't keep taking unemployment benefits if your business has reopened? So what course of action should those people take?
Well, I'm gonna pass to our, you know, to General Hoyer and you know, but I'm gonna say just this, that if you're an older person and you're worried and you can't keep continuing to get unemployment benefits and you're really worried and you can work at home and do those kind of things, I want you to call us. I mean, that's all there is to it, because if you've got somebody that's being unreasonable and pushing back and doing what they shouldn't be doing, then I don't like it. I want all of us to do one thing, and that is just this. I want us to pull a rope together. Now, there's certain rules, just like we're waiting on the rules to be able to backfill the revenue, and we may not get the rules that we want, but I think we will. But at the same time, you know, there's rules that we got to go by. You know, we may not like those rules, but there's rules in life that you have to go by on everything. But at the same time, I want everybody to try to work together in a way of trying to have absolute harmony, and we can do that. So if we got people that are not doing that, I want to hear about it.
All right, thank you, Taylor. Next, we'll go to Shakira Hawkins with WOAY. We may have trouble connecting with her. Next, we'll try Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I have a question for either Secretary Crouch or Dr. Marsh. Now that we have completed the testing of the governor's mandated nursing home program, when will we see a timeline and the plan for continuing our testing program with those other vulnerable populations that we've all mentioned? When you talk about community assisted living, retirement homes, African Americans, et cetera, et cetera, et cetera. Now that this huge job of nursing homes is out of the way with 28,000 testing, where do we go on Monday?
Bill, you want to address it first? You want me to?
Go ahead, Dave, and I'll follow up.
Good. Well, I think that's a really important question. And as we go forward, you know, we see, at least from my perspective, we see the opportunity to continue to test congregate settings, but also start to simultaneously reflex towards some of our vulnerable communities. And I think what you heard yesterday from the governor and from Secretary Crouch was the sort of the recognition and emphasis on making sure that we start to address communities like the African American community with testing. And certainly, as I think has been mentioned before, but we have heard from leaders in that community and understand the difficulties of issues like finding a physician to get an order and making sure that they individually know how that's going to be paid for. So we are working through some of those logistics. You know, the secretary is organizing a DHHR, the foundation for an advisory group that that we can lean on to have more input about how testing and further approaches may be done. But certainly as we look at the African American community as a vulnerable population, we want to move there quickly. And we also want to look at other vulnerable populations that may not be in congregate settings. So Bill, I don't know if you have other comments.
No, that actually covers it very well. We're looking at the assisted living population, which is very close in terms of the long-term care patients that we've just tested. So we're looking at all of those populations. We've compiled a list of those types of settings, and we're looking at the numbers of tests that would be needed. Next week, I think we'll have more information for you on that. So that's a good question, Kenny, and we've been discussing that every day for the past week or so. Let me just for 1 second, if I can, go back to the previous question and say anyone out there that needs additional services, DHHR is a safety net. We have actually hundreds of services, and I'm always amazed at our staff and how they come up with ways to get people services that need those services. So I just wanted to toss that out there. Thank you.
All right, thank you, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Tried the mask. Sorry. Had my mask on at the behest of Dr. Marsh. This question's for the governor. You indicated a worst case scenario could have us $700 million short in the first quarter of fiscal 21. Do we have any projections from revenue people as to how the gradual reopening of the state will start to cause state revenues to rebound, and how long that will take?
Phil, we're going to meet again today at 4 o'clock. I called last night. I said, after we met yesterday, that I don't want to wait. I don't want to wait around for, even though the information's incomplete, I need to have more and more information. And so even though we met yesterday, I'm calling them back again today at 4 o'clock. Phil, naturally, the $700 million number is a number that is, without, I'm sorry. The $700 million number is a number that would basically be a catastrophic type number, that this situation, as far as being shut down, would for the most part be shut down through September. And so it would take into consideration the first quarter, July, August, and September, and so you would really be shut down until October. And so we don't think that's going to happen, but, not knowing the numbers and just not thinking it's going to happen isn't good enough, so we're going to continue to meet and continue to digest the numbers until we, so we don't get in a situation where we don't assume, and you know what assume means, and I do too.
All right, thanks, Phil. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, some of this may come out at the 4 o'clock meeting, but really I'm wondering, given the steep slope of state revenue, how far into the month can West Virginia get in being able to pay the state bills? Is there any concern about just being able to pay the bills through the month?
No, Brad, there's not. Basically we've taken provisions to be able to do that, and I think we're really good through the entire month of May, and probably even out to about June the 10th or whatever. But we're on top of that. I mean that's a very good question, and has been a legitimate concern, but it's been something that we've worked on. We started working on weeks ago, to tell you the truth.
All right, thank you, Brad. Let's go to Charles Young with WV News.
Hi, Charles Young, WV News. Governor, you said that there's going to be additional guidelines coming out over the weekend about the hotspots. Has there been any consideration to taking counties off of that list, or all the ones that are designated as hotspots going to remain that way for the foreseeable future?
No, there's been some real dialogue about taking counties off the hotspot list, and that may very well be a possibility. But those things are a little incomplete right now. You know, we've gathered a ton of information from people, and we're reviewing that, and we'll come out with those recommendations over the weekend.
All right, thanks, Charles. Next, we'll go to Kara Lofton with West Virginia Public Broadcasting.
Hi, Kara Lofton with West Virginia Public Broadcasting. So I'm hearing from a lot of moms, I'm a mom, that although daycares are opening, there's a lot of concern about whether or not parents should take their kids. And I was wondering if you had any sort of guidance about whether or not, you Governor, you've been seeming like you're urging people to remain socially distant if they're able. Can you make some recommendations specifically for parents during this time?
Well, I think it was Sarah. Sarah, I can share in everyone's concern, and I keep going back to the same thing. This is something that none of us have experienced before, and all of us are walking in areas that none of us have ever been. The DHHR is putting out guidance to the daycare centers as to what to do. And those daycare guidance will be there for everyone to read. Okay, and Clay will be participating in this, and he'll do some of this answer when I get through here. But I would just say this to you as if you have a way, a family member to take care of your children and everything else, we want our daycare centers to be open. There's no question. But we want everyone to be as cautious as they can possibly be, and we don't need to run back into this situation. We need to crawl back into this situation, and we have to have our daycare centers open, because we got, as people go back to work, they've got to have a place, to take their children, and so it is another balancing act. But use our guidelines and use your conscience, and we will be testing the daycare staff, and we'll be on top of it. So just use your best guidelines you can possibly use, and use our guidelines and all of our information, and we'll be okay. And Clay, maybe you jump in and finish that up.
Yeah, Kara, I think your question's a good one, and actually I think the governor answered it very well. CDC and others have guidelines. We are testing workers in daycares to make sure that we reduce any sort of recognized ability to spread. But as we come back out again, then as we interface and have our children interface, it does increase the susceptibility to having a child or someone else in that environment pick up the COVID-19 virus, and that child could get sick if indeed picks up the virus, also can communicate it to parents. So I think not only looking at guidance to separate people appropriately and try to create that safe environment in the daycare, test the workers, but particularly if one of the parents has a vascular problem, a lung problem, has any issue with immune system function, then trying to perhaps find in-home care would be potentially a good option in that level. And I think as we continue to go back, we will understand more specifically some of the risks involved and start to learn more. So I think the governor's instruction to move slowly if you can is good guidance, And at the same time, I think that as we get back out again, we'll start to understand the risks not only of daycare, but of all the other, businesses and the openings and the interactions that we will see grow.
All right, we have time for one more. Let's go to Mark Curtis with Next Star Media.
Good afternoon, everyone. This is probably a follow-up to something the governor mentioned, and I'm going to direct this to Dr. Marsh and maybe Secretary Krause. But governor noted it is May 1st today, and that we're having much warmer and sunnier weather on the way this month. How much of that is a factor? I've heard this elsewhere that can help knock down the spread of the disease. How much of that is a factor? And really, what kind of temperatures and days of sunlight are we talking about for this to really be a factor?
Okay, Mark, I really appreciate the question, and I've talked a lot today and everything, so let's let Bill and Clay answer that. They can probably do it better than I can.
Oh, you want to go first, or you want me to take the first shot?
All right, go right ahead, Clay. Thank you.
Yeah, so Mark, that's a good question. For many viral infections, we certainly see a diminution, a reduction in the warmer months. And we do know about the COVID-19 virus that UV light, sunlight, seems to be beneficial in reducing the lifespan and sort of the health of the virus. So we do anticipate, as people are more outside and not inside together, that will help certainly distribute any kind of droplet spray that may happen, and the sunlight will help. But we also don't know if this virus will follow the same trends as other viruses like influenza or others. We would anticipate to see a reduction in the virus's ability to kind of survive and infect. We don't know that. We have to be very careful. And that's the reason why I think you hear Dr. Redfield and Dr. Fauci and other people being worried about the fall and the winter as it gets colder and people come back together. I think the sunlight may not be the major thing. It may be the distribution of people and being outside, which is the reason why in, say, even TB sanatoriums, they were in areas where there's a lot of outdoor space, because the infectious sort of transmission of respiratory viruses or infective agents is reduced in the outside. Much bigger distribution of space for the droplets to dissipate to.
I think the safest thing to do, Clay, I can't say it any better than that, but I think the safest thing for West Virginians to do is assume that this virus is not going away. It will still be here in the fall. And West Virginia is number one in fighting this virus for two reasons. One is the governor, for some reason, has his finger on the pulse of this disease. He's made decisions that are proactive, that have kept West Virginians safe and have saved lives. Number two is West Virginians are smart. So as we go forward, Dr. Marsh has some of the best insight on this from all over the world, as well as from other states. So we will try to update you as we go forward and make sure we give you the best information possible. But we want you to continue to stay safe and continue to keep your family safe. Thank you.
All right, thank you. Mark, Governor, I'll turn it back to you.
Okay, like every weekend is, if we have a need to come back to you, we'll come back to you over the weekend. If not, we'll see you back here on Monday. I want to go over just a couple things really quick. I want everyone to take heed to what we've been saying. We've been saying over and over and over, to be cautious about what you do. We do feel like that it is surely safe to move forward. We do feel like we've got all the backup behind us to run to the fire if we have an outbreak somewhere. But I can tell you this, and this I can tell you with all my heart, is if in fact we have a problem, we'll back up and if need be, and I hope and pray we don't have to go this far, but if need be, I'll close it back down. That's just all there is to it, because if in fact, this thing turns the wrong way, I'm going to react, and I'm going to react before that we end up with a bad situation. And so with all that being said, and I think our experts are going to do the same thing, And I want to go back to something that Secretary Krause came up with, and and saying that, or making a point to say that this is Mental Health Month, and we need to know that there's a lot of people that are struggling out there in a lot of different ways, and we welcome them to call us on our website or call somebody. I mean, it's a tough time, and it's especially tough on people that are having mental health issues. So, last thing I want to say is this. A lot of times we kind of skip by these people that are not forgotten, but just think about the people that are out there, the mail carriers, or the people that are delivering the FedEx packages or the UPS. Think about when the stores were closed and we needed stuff, and yet those people are bringing stuff right to your homes. I mean, those people are doing, valiant work, and absolutely we commend them and thank them from the bottom of our heart, and all those that are associated with doing something just like that. Just think just for a second over the weekend about your county health departments and all the stuff that they're doing. We talk about our experts and all the healthcare community and all that, and they're doing fabulous. They're fabulous beyond belief, and whether they be grocery store workers or whatever. But think about your county health department. Think about the hours that they're going around the clock, with testing and all the stuff. They're visiting the nursing homes, and they're doing everything. Everything. They are our boots on the ground. And so think about them in your thoughts and your prayers as well. And West Virginia, we're going to get through this. You have to realize just one thing here, and this is the thing, and this again is a little tough, but it's just the truth. When you get out, when you walk out your door and you get in your car, you're taking the level of risk. We're trying to diminish the risk with this disease as low as we possibly can, but nobody can take the risk away. Not today. Nobody has a surefire cure medicine. Nobody has a surefire vaccine. Nobody can take the risk away. So, what do? You've got to learn to live with this. And you can live with it if you'll just be really smart. Social distance. Absolutely wear a mask when you go out. Absolutely just listen to every single thing we're telling you. Use your head. Take care of the elderly. And absolutely we'll continue to trend well. And as we continue to trend well, every day we're closer to having that drug. Every day we're closer to having that vaccine. West Virginia will come back and be the leader of the world like we already have if we'll just continue to all pull the rope together. God bless you, and thank you so much.